Most women have them, and many don't even know. They silently grow, feeding on your hormones, distorting your womb, disrupting your cycle, and sometimes even threatening your fertility. But no one's talking about them properly. You've probably heard the word fibroids, but what if I told you that what you think you know about fibroids may be missing the most important pieces? This video is not just another surface-level health breakdown. We're diving deep into the unknown side of fibroids. What causes them? What makes them grow fast? Why some women never get them while others are overwhelmed? And the shocking truths about their relationship with your lifestyle, stress, diet, and even your environment. Stick with me to the end of this video because some of this information could truly change your health forever. Welcome to BioFit, where we break down complex health topics in simple, powerful ways. If you're passionate about understanding your body better, reversing symptoms, and optimizing your wellness naturally, you're in the right place. What are fibroids really? Uterine fibroids, also known as leiomyomas, are non-cancerous tumors that grow in and around a woman's uterus. They're made of muscle and fibrous tissue and can range in size, from as small as a seed to as large as a melon. There are 4 main types: intramural fibroids, grow within the wall of the uterus. Submucosal fibroids grow just under the lining and can interfere with menstruation and fertility. Subserosal fibroids grow on the outer wall. Pedunculated fibroids grow on stalks attached to the uterus. Here's the thing most people don't know. Fibroids are not all the same, and their behavior depends on their type, size, location, and most importantly, what you feed them. It's estimated that up to 80% of women will develop fibroids by the time they're 50. But why is it so common? Hormones, especially estrogen and progesterone, fuel fibroid growth. Women in their reproductive years are most affected. Genetics. If your mother or sister had fibroids, you're at a higher risk. Ethnicity. Black women are 3 to 4 times more likely to develop fibroids, and they often get them earlier, larger, and more aggressively. Environmental triggers like endocrine disruptors found in plastics, cosmetics, and pesticides. Vitamin D deficiency is also linked to increased risk. Let's get one thing clear: fibroids are not your fault, but there's a lot you can do to control them. Signs you might have fibroids. Many fibroids go undetected because they cause no symptoms, but when they do, the signs are often misunderstood. Here are common signs you may have fibroids: heavy or prolonged menstrual bleeding, pelvic pain or pressure, bloating and abdominal enlargement, frequent urination, painful intercourse, lower back pain, constipation, infertility or miscarriage. Many women mistake these signs for normal period issues, which leads to years of suffering without proper diagnosis. If you've made it this far, you clearly care about your health. While you're here, kindly hit that subscribe button and give this video a thumbs up so we can keep creating life-changing content like this. Let's get back to it. What causes fibroids to grow? This is where it gets deeper. Several hidden factors make fibroids grow or worsen. Excess estrogen dominance. This can happen from birth control, poor liver detox, xenoestrogens in the environment, poor liver function. Your liver breaks down estrogen. If it's overwhelmed, estrogen builds up. Chronic stress. Elevated cortisol levels can disrupt hormonal balance, favoring fibroid growth. Diets high in sugar and processed foods. These increase inflammation and feed fibroids. Obesity. Fat tissue produces estrogen, worsening the imbalance. Poor gut health. A weak microbiome affects estrogen recycling and detoxification. This is rarely talked about. Stress hormones like cortisol interfere with progesterone, tipping your body into estrogen dominance. Chronic stress also weakens immunity, elevates inflammation, disrupts gut function, all of which create a perfect storm for fibroids to thrive. Now you're probably asking, can you shrink fibroids naturally? Yes, but not overnight. The goal is to create an internal environment where fibroids can no longer thrive. Here are powerful natural strategies: Diet rich in cruciferous vegetables like broccoli, kale, cauliflower, flax seeds help bind and remove excess estrogen. Castor oil packs reduce inflammation and boost circulation. Milk thistle and dandelion support liver detox. Vitamin D supplements, green tea extract, EGCG, shown in studies to reduce fibroid size. Regular exercise and weight loss. Some foods, however, feeds fibroid, and you want to run away from them. Here are foods to avoid: dairy with added hormones, red meat, especially processed, alcohol, sugar, and refined carbs, soy-based processed foods due to phytoestrogens, non-organic produce with pesticide residue. Myomectomy and hysterectomy are common treatments, but they don't address the root causes. Fibroids often return after surgery if hormonal imbalances aren't corrected. Hysterectomy, while permanent, has long-term hormonal consequences. Some women regret surgery due to early menopause symptoms or complications. This doesn't mean surgery is wrong, but you should be informed, not rushed. The health of your gut is directly linked to the health of your womb. Most people don't realize this, but inside your digestive system is a group of bacteria called the estrobolome. Their job is to process and eliminate excess estrogen. When the gut is inflamed or imbalanced, often from antibiotics, low-fiber diets, or too much sugar, these bacteria are disrupted. Instead of flushing estrogen out, it gets reabsorbed into your bloodstream. This estrogen buildup fuels fibroid growth. To protect your gut and reduce fibroids, increase fiber intake from fruits, vegetables, legumes, and seeds. Eat fermented foods like sauerkraut, kefir, kimchi, and yogurt. Add prebiotic-rich foods like onions, garlic, and asparagus. Limit alcohol, processed sugar, and artificial sweeteners. Include probiotic supplements if your gut has been under stress or after antibiotic use. A healthy gut creates a healthy hormonal balance. You're not just improving digestion, you're cutting off the fuel line to fibroids. Chemicals you're not told about every day. You're exposed to hidden chemicals that mimic estrogen, called xenoestrogens. These fake estrogens confuse your body and fuel fibroid growth. They're found in plastic containers and water bottles, BPA and BPS perfumes, lotions, makeup, and soaps, phthalates, non-organic fruits and vegetables, pesticide residue, canned foods lined with hormone-disrupting chemicals, household cleaning products. Here's what you can do. Switch to glass or stainless steel containers. Choose fragrance-free or natural cosmetics. Use a water filter that removes heavy metals and hormone disruptors. Buy organic produce, especially the dirty dozen. Avoid microwaving food in plastic containers. Every small change reduces your exposure and helps rebalance your hormones from the outside in. Detoxification, liver and lymphatic support. Your liver is your main detox organ. It processes and clears out hormones, including estrogen. But when your liver is overwhelmed by processed food, alcohol, medication, or toxins, it can't do its job. This leads to estrogen accumulation, a major factor in fibroid growth. Support your liver by eating bitter greens like dandelion, arugula, mustard greens, drinking lemon water in the morning, supplementing with milk, thistle, turmeric, and NAC, reducing or eliminating alcohol and processed fats. Your lymphatic system also plays a huge role. It moves waste and toxins out of your body, but it has no pump. It needs your movement to stay active. Boost your lymphatic flow with hydration, at least 2 liters of clean water daily, gentle yoga or walking, sleep, and melatonin's role in hormone balance. Melatonin isn't just for better sleep. It has powerful anti-estrogenic effects and has been shown to inhibit fibroid cell growth in some studies. The problem is, many people aren't producing enough melatonin, especially with late-night screen use, artificial lights, and stress. Simple habits to support melatonin production. Avoid screens and blue light after 8 p.m. Sleep in a completely dark room. Keep your bedroom cool, around 65 degrees Fahrenheit, 18 degrees Celsius. Go to bed at the same time every night, ideally before 11 p.m. Quality sleep helps regulate cortisol, insulin, estrogen, and growth hormones, all of which are involved in fibroid growth and repair. Intermittent fasting and blood sugar control. Fibroids thrive in a body with high insulin and unstable blood sugar. Every time you spike your blood sugar with carbs or sugar, your insulin goes up. Over time, this leads to insulin resistance, fat storage, and elevated estrogen. That's where intermittent fasting comes in. It lowers insulin levels, triggers detox and cellular repair, autophagy, reduces inflammation, may slow fibroid growth naturally. Start with a 12-12 fast, 12 hours fasting, 12 hours eating. Then work up to 16-8 as your body adjusts. Pair it with low glycemic meals, leafy greens, avocados, lentils, chia seeds, wild fish, or pasture-raised chicken. Stabilizing your blood sugar is one of the most powerful things you can do for hormone balance. When to seek medical support. Natural approaches are powerful, but there are times you should absolutely consult a doctor. Uncontrolled or severe bleeding, rapid fibroid growth, severe anemia or fatigue, pain disrupting your daily life. Fertility concerns. You can still take a holistic path with your doctor's support. The key is informed, empowered choice, not fear-based pressure. Fibroids aren't random. They're rooted in how we eat, how we live, and how we feel. You have more power than you've been told. Now, you know what most people don't. Fibroids aren't random. They're rooted in how we eat, how we live, and how we feel. You have more power than you've been told. So if this video helped you see things differently, here's what to do next. Hit the like button so it reaches more women who are still confused and scared. Subscribe to BioFit so you never miss another video like this. We go deep into natural healing every single week. Turn on the bell icon so you're first to see future uploads, and drop a comment below. What part of this resonated with you the most? Thank you for watching. Your body is wise, and it's always working for you.